At a meeting a few months ago, Mahoning County Health Commissioner Pat Sweeney talked about her agency's priorities, among them opioids, infant mortality, and then she mentioned diabetes. I was taken by surprise. I didn't realize diabetes was such a health priority. So I looked into the matter. 27 investigates the problem with diabetes. Richard Scott lives just north of Wellsville in Columbiana County. 18 years ago, when he weighed 300 pounds, Scott was diagnosed with type 2 diabetes. He's had it ever since.
Main thing is the nerve pain in my feet and legs.
So people who have diabetes have less healthy days, and they often don't feel well.
Pat Sweeney is Mahoning County's health commissioner, and what concerns her most are the people now dying from diabetes.
For the first time this year, diabetes is one of the top 6 causes of death in Mahoning County.
Sweeney guided me through the numbers behind the diabetes problems in Mahoning, Trumbull, and Columbiana counties. In 2016, 36% of type 2 diabetes patients had heart disease, 56% had hyperlipidemia, too much fat in the blood, and 78% had hypertension. The A1C test is the best way to determine diabetes. Anything above 9 is really bad, and 40% of type 2 diabetes patients in Mahoning and Columbiana counties had A1C levels above 9.
If we could get people to be aware that they need to be tested and get into education on how to manage and control diabetes and get on medication to help control it, you have much less likelihood of that morbidity that I mentioned of feeling ill.
There's my pills. Here's my metformins.
Richard Scott keeps his medications in one container, including the syringes for his nightly shots.
Twist it, peel that off. There it is.
He also wears special diabetic shoes to help with his foot pain. He watches his diet and walks.
I'm not saying it's a normal life, but I live a good life, you know, and I don't let it get me down.
We have about a 70% reported rate of people who are inactive.
And that, says Pat Sweeney, is the primary reason why diabetes is more of a problem around Youngstown. Healthy eating and exercise decreases the likelihood of diabetes, neither of which we're set up for.
We don't have opportunities for bike paths everywhere or sidewalks connecting neighborhoods. We don't have communities with mixed living and mixed use so that you don't have shopping and living all in the same place where people can walk and be active. Don't have doctor's offices with sidewalks to get to.
The Valley Health and Wellness Expo is taking place this Saturday and Sunday at the Covelli Center, and the A1C screenings that you just heard about will be offered at the expo. There will also be a panel discussion on diabetes Saturday at 2:45 p.m.